We're going to get started when we get enough members here for a quorum, okay? All right, we got a quorum. Representative Stevens, would you like to begin with HB 473, LC 481480? Go ahead.
Thank you, Mr. Chairman. This bill is our annual department bill, our drug update bill. Typically, when there is a movement of designer drugs, if you will, we have to make sure that they're those that are in the proper classes, like class 1, which means they're a drug that is has no medical use, usually highly addictive. For example, in section 1, you'll see that methyl AP is an opioid designer drug. Lots of overdoses come for that one. That's in a class 1. Another one below that you'll see is a synthetic mushroom type drug, and of course we'll be talking to you about this particular isomer next week on Monday, where there may be this drug moving from a class 1 to something else that can be used for extreme types of depression, and that'll come to you on Monday. Ethylphenidate on section 3 is the cousin to methylphenidate. If you've heard of Ritalin for kids, that one's also there, but it's a stimulant and is a problem, so it's in a class 1, no use. And of course, the one you've got, the tetrahydrothiophene group is sports doping, and the rest of these, of course, are just in prescription drugs, and this is just an update.
Great, thank you. Are there any questions? I see none. Do you have a question, Representative Mitchell? Oh, okay. Go ahead.
I make a motion to pass.
Second.
All those in favor say aye.
Aye.
All those opposed? Congratulations, LC 481480 do pass.
Thank you, Mr.
Thank you,
Chairman
sir.
and committee.
Up next, Representative Katie Dempsey. You've got two bills. Do you have a preference of which goes first?
Why don't we do the
I'll let
dentist?
you choose.
Let's do the dentist for you.
All right.
Let's do that one.
So we're going to hear HB 567 first.
Yeah, great.
Let me see. And that LC is 461179S. Floor is yours.
And I am going to tell you, I don't have a copy of the sub because it's so hot off the presses. Thank you. Appreciate that. Okay. Good. All right. So this is some of you that were on the committee last year are probably familiar with this bill. I'm doing a lot of repeat things. This was a bill that the governor vetoed, but gave us some great guidance on things that he'd like to see in it to make it pass, and also said that he fully supported teledentistry. So there's been a lot of work in the interim to try to make it better and get it where it can do what it was intended to do. So it will authorize and regulate the practice of teledentistry in Georgia by Georgia licensed oral health care team members through the Georgia Board of Dentistry to ensure that patient safety remains the priority while maintaining a continuous standard of care and sustaining the Georgia licensed dentist as the leader of that oral health care team. It works within current general supervision law for hygienists. It also allows them to work outside of a private practice setting in both safety net settings that were established in 2017 and other locations. The goal is to create a network of dentists within Georgia that allow providers to share workforce and gives Georgians better access to oral health care. I think this can be really useful as a modality for triage, for consultation purposes. Due to the inherent tactile nature of dentistry, someone must be in your mouth at some time to actually provide most of the work that would be there. So there is a problem ultimately that the patient still must see a dentist and receive treatment. So it's not keeping you from being with a dentist. It is often used as the beginning of that process or in spaces and places where we do not have immediate dental access. From a patient safety perspective, the GDA also wants to ensure that all patients know the identity of their dentist and how to get help. So here's what it does do. It allows patients with a dental home to establish care with a dental provider in order to receive consultation and direction to appropriate care. It will allow dentists to use teledentistry to authorize hygienists to perform very specific hygiene functions under general supervision in accordance with existing law. It also creates a real-time diagnosis from a licensed dentist in Georgia for treatment and requires teledentistry only be performed by qualified members of that oral health care team. It also requires that the patient and dentist both be physically located in Georgia. This is not crossing lines in any way here, with the dentist verifying the patient's location, identity, and obtaining consent. It ensures that patients receive standards of care in other dental care settings, including appropriate patient examination, x-rays, a review of a patient's medical and dental history, and in-person treatment when clinically indicated. It prevents insurers covering dentistry from mandating teledentistry appointments. So specifically, let's talk about what it does not do. It does not create an unreasonable scope of expansions or replace the need of in-person dental exams and procedures. It does require patients to sign waivers releasing providers of liability at any time. And it does not change current general supervision regarding timing of consults. Does not change what is currently allowed under any part of the General Supervision Code as it is written today. And it does not require any dentist who does not wish to practice to do teledentistry. So there is no forced effort in this. You don't have to have a permit. You just don't have to do it without the permit. Does not negatively impact oral health care. Currently, this is allowed in Title I schools, preschools, long-term care facilities, and nursing homes. So that same care will be allowed. And it does not mandate insurance coverage of teledentistry. There are 3 specific changes to what we produced the last 2 sessions that y'all worked on and did pass out of committee. We removed the language mandating that the coverage of teledentistry by insurers and appropriately situated insurance-related language in the relevant code section. So there is not the mandate. We amended in-person visitation requirements to allow patients without a dental home to establish a dentist-patient relationship via teledentistry to begin that journey. We adjusted referral requirements for enhanced provider flexibility and referring patients to in-person care. That is basically what this measure will do. And if there are questions or additional comments, I'd love it.
Any questions from the committee? I see none. We have a few folks that have signed up to speak to the bill. Dr. Ben Jernigan. If you'll come forward and speak from the same mic.
Thank you, Chairman Hawkins. I'm Ben Jernigan. I'm a former president of Georgia Dental Association. I represent Georgia Dental Association in speaking today. We have 3,400 members in the state of Georgia. I'm also a full-time private practice clinician in Decatur, Georgia. We need a bill to clarify what we may and may not do with regards to the rapidly changing world of electronic remote access in health care, specifically with this bill, dentistry. This bill clarifies the rights and responsibilities for dentists who practice both in person and remotely. Also, very importantly, this bill protects the citizens of Georgia by assuring that their care is being delivered remotely as provided by a properly licensed dental care provider under the laws of Georgia. One of the main purposes of this bill is patient protection. Representative Dempsey went over some of our talking points, but I'd like to emphasize that providing patients that do not have a dental home to be able to remotely establish care with a dentist is very helpful in the underserved areas of Georgia, which, as you know, we have a lot. So we feel this bill, as presented, will safeguard our patients, protect our profession from unlicensed or unqualified providers, and also give clear guidance to our State Board of Dentistry. Thank you.
Thank you. Are there any questions from the committee? I see none. Thank you.
Thank you.
We also have Steve Tippins signed up to speak.
Thank you, Your Honor. If it pleases the committee, Steve Tippins. I'm here on behalf of the Georgia Dental Hygienists Association. You may recall the previous iterations of this bill that Chairman Dempsey mentioned the hygienists had opposed in the past. I'm happy to say that last year's version of the bill, after some rather protracted discussion, we may say debate, we were able to come to a consensus with the Dental Association and were in agreement with what was then 441 prior to the veto. This year's bill is largely the same. There is one glaring omission that has caused us to raise a question. I'm not here to say that we oppose the bill. I'm here to ask for y'all's insights and deliberation on what were last year's bill lines 98 through 110, in which a carve-out was granted to DPH in what we call safety net settings, in which the initial consultation that the bill calls for was accepted. Now, I understand from talking to the author of the bill and several others that requirement, the need to have a physical examination at an initial consultation, has been removed from the bill entirely, and therefore the carve-out for DPH in these safety net settings is not needed. Now, I do believe that is the intent of the bill, and this bill may well accomplish that. There may not be a need for that carve-out. It is not entirely clear to my clients reading the bill that is the case. So I would welcome y'all's insight on that and simply say that we look forward to working with the author to make sure that the lack of a need for the carve-out for DPH, if that makes sense, is indeed accomplished by the way the bill is worded. Other than that, I have nothing further for the committee, Your Honor.
Would you like to speak to the author, Representative Dempsey? That microphone. Yep.
Thank you. I'm Janelle with the Georgia Dental Association, if I haven't had the pleasure to meet you yet. So we, in working with the governor's office and being sure that we were providing proper access to care, we removed an initial in-person requirement before you could start teledentistry. So you can now do a teledentistry appointment without being seen in person, especially for those that don't have a dental home already. Removing that requirement based on the consultations that we've had, we were able to remove that carve-out because they were needing that carve-out to be able to do teledentistry without the initial in-person consultation. Now that we removed that requirement, there's not a need for that carve-out.
Is that it's acceptable?
Well, Your Honor, what I was saying was I do believe that is the intent of the bill, and I do believe the bill was drafted to accomplish that. I'm not convinced that the bill does accomplish that. That is not to say that it doesn't. I simply haven't been able to assuage any fears to the contrary. But I look forward to working with the author to maybe assuage those fears as we go.
Thank you. Thank you. There is a question. I'm not sure who's Representative Parsons.
Thank you, Chairman. I'm just reading quickly through this bill. It looks like it mainly is dealing with cleaning of teeth and things like that. Is that correct? Is that correct? Okay. Then my second question is, I've heard so many things described as telemedicine over the last 5 or 6 years, up to and including somebody getting on a telephone and calling a patient after they've been there and said, you know, how you doing? And that's telemedicine, which I don't agree with it at all.
You know,
But what is it? I mean, and I don't mean to hold it up or anything, but what in here, I'm just looking through it real quickly. So what is it that makes this telemedicine? You got somebody in the field, I guess, a dental hygienist. They're working under the direction of a dentist.
directly under that.
So, I mean, are they like using a iPhone to kind of show what they're doing, or? where's the telemedicine come in?
So the idea of this is that you would schedule a teledentistry visit the same way you would schedule a telemedicine
Right.
one. You would end up on the screen with a dentist. The idea is that if you are injured in the mouth or something pops up over the weekend and a dentist is not open on the weekends or it's after hours, you could speak with a dentist virtually
Yeah.
to assess the problem, and they could triage, you need to go to the emergency room right now. You can wait till Monday, take a Tylenol.
Okay.
We'll get you when we need you. So the idea is hopefully to save patients from going to the emergency room unnecessarily.
Okay. All right. I'm just trying to. But it would be telemedicine in the sense that. How does it, if somebody has an emergency situation, how are they seen telemedicine wise by whomever?
So they would
To know that they need to send them to the emergency room.
right. So they would be able to get on the screen with a dentist that practices
what screen? I
teledentistry
mean, what-
on their phone.
Okay.
This like a Zoom call, the same idea like that, and then the dentist on the other end would be able to say, look, that tooth needs to get pulled. You need to go see somebody right now. You've got a serious problem, or hey, it's okay. Put some ice, take some Tylenol.
Well, couldn't they do
we'll see you
that
on
now?
Monday.
I mean, they need legislation that dentists can't do that now.
We don't currently have any general authorization in the state for teledentistry, with the exceptions of some public health stuff.
Okay, I won't ask you more questions.
We did some exceptions during COVID,
Yes.
I believe, that allowed for those kind of visits, but time has passed, and now it is a way, particularly, I mean, I know there are pockets in South Georgia that do not have access, but it's done by a dental or oral care team. A Georgia dentist must be the supervisor, so it's not just one person looking at it. It's trying to decide what is best practices and to keep someone from the emergency room if it can wait till Monday.
Okay, all right, thank you.
As a retired dentist, I see an application here that I think would happen more often. Hygienists can work under general supervision, see a patient, clean their teeth if that patient does not need an exam.
Yeah.
So when we go out of town, we have another dentist covering for us. With this legislation, the hygienist may see something that she thinks needs to be seen, possibly sooner than the returning dentist the following week, that she would contact the dentist that is filling in or covering for that dentist, send scans and x-rays, and then that dentist can make a decision. You need to send this patient over to my office since they're covering, or I'll call in some antibiotics and your dentist can see them when he gets back. It's not an immediate need. So I think that's where it'll probably come in as a more important aspect to treatment for patients. Do you have a question, Representative?
You answered a lot of it, unless there's two different areas, if you don't mind. There's the teledentistry you seem to describe seems to be just the patient and the dentist and a teledentistry application. There's no, and I don't know how they expect you to. I know I've done telemedicine, and you try to have somebody look at their throat, and about half the people you can see and half you can't.
Yeah.
So it helps if you. So I've done it with a school nurse who can take them through an exam. And what you're describing, Chairman, seems to be the way that would make a good bit of sense. Is that you've got a trained dental individual there who's seen some unusual things and has somebody at their. They can be out there even, like you say, when the dentist is not immediately present. That seems to be a different level than just an individual going online and doing a teledentistry phone call. I'm sorry, a Zoom, FaceTime.
Yeah, so it's kind of the same idea as, if you were home with a stomach bug and you needed some Zofran or whatever, you could schedule a telemedicine. The doctor on the other end could prescribe you that Zofran. You take your Zofran, you're good to go. So there's that aspect of teledentistry. There's also the aspect of teledentistry that is similar to what Chairman Hawkins just described.
Are we proposing allowing both of them in this bill?
Yes.
In different sections, or?
It's not really in different sections. We're following the accordance of general supervision so that we're allowing dental hygienists to help where they are allowed to help, for the idea of if the dentist is somewhere else, they can the dentist could be on teledentistry and the hygienist can be there doing the things under general supervision or at the direction of the dentist.
When this was first presented, it was brought up about the challenges too in nursing homes and some of our sort of dental deserts, in other words. So rather than have to put a patient quite often in an ambulance or some sort of transport to get them to the dentist, there could be a checkup that occurred this way to decide if that was actually needed or how urgently that was needed.
Sorry.
Okay.
All right, any other questions? I believe, did you want to have a statement from the?
Yes.
There's a statement from the president. Thank you. She has a statement from the president of the Georgia Dental Association.
Yes, I'm just so everyone knows, I'm reading on behalf of Dr. Amber Lawson, who is our 2025 GDA president. She's out of the Macon area. She says, "Good afternoon, committee. I apologize for not being able to be there in person, but my patient schedule today is preventing me from attending. I thank you for allowing me to provide some testimony through this statement. House Bill 567 strikes a balance that enhances access to patient care while providing key consumer protections. Teledentistry is a modality that expands the reach of a dentist, and it would enable dentists around the state to provide education, consultation, and follow-up to all Georgians. Many patients' access to dental care is limited by distance, time, or financial restriction. Teledentistry enables access to a dentist's judgment anywhere in Georgia. This can allow for triage, preventing unnecessary emergency department visits, and it can allow for education and referral to help prevent more serious problems. Ensuring that all patients receive safe and ethical care is of great concern, and the bill before you has been written to prioritize patient care and quality of service. The Georgia Dental Association, in conjunction with the American Dental Association, advocates for common sense patient protections. Dentists authorizing teledentistry services for Georgians must be licensed by and in good standing with the Georgia Board of Dentistry and practicing in the state of Georgia. This bill also ensures that the Georgia Board of Dentistry maintains jurisdiction over dentists practicing teledentistry. By ensuring patients conducting teledentistry are subject to the same standard of care as in-person dental visits, patients can be sure that they are being adequately protected. With your support of this bill, we can ensure that Georgians receive safe and effective care through teledentistry. Thank you for your time and leadership, Dr. Amber Lawson."
Thank you. All right. That's all that signed up to speak. I see no questions from the committee members. Do I hear a motion? Do I hear a second? All those in favor say aye. Aye. All those opposed? You have a due pass on House Bill 567, LC 461179S. Representative Dempsey, would you mind if we let Representative Gullett go, because he's got another committee that he needs to present in. Okay. And that is House Bill 522. House Bill 522. Go ahead.
Thank you, members of the committee. House Bill 522 is really a bill that we passed last year that got caught up in the Senate. It was House Bill 576. It passed this committee, passed the House, and got caught up over there. We're working to get them to move. What it does is, back in 2020, there was Gracie's Law that was by Representative Rick Williams at the time, and it created fairness in organ transplants for those with disabilities. And so what this does is really not much different, but it creates, it adds COVID-19 where it can't be the sole discriminating factor for an organ transplant. That's really what it does. You can have other reasons of why someone won't qualify for an organ transplant. It just can't be specific to only the COVID vaccination. That can't be the reason.
Right.
Happy to answer any questions for it.
Are there any questions from the committee? Okay, I see none. Do I hear a motion? Do I hear a second? All those in favor say aye. Aye. All those opposed? You have a due pass on LC 339780.
Thank you so much.
Thank you.
y'all.
Okay, Chairman Dempsey, would you like to come back aboard? And we will hear now HB 612.
And I believe that is LC 339795. Thank you so much.
You're welcome.
So this is a measure to try to deal with parity. There are some great challenges. Y'all know that we passed a bill not too long ago. I see Representative Oliver over my shoulder, who was very involved in the 1013 bill that Speaker Ralston brought forward. And we have found out that there are challenges in finding those parity reports. There seems to be some discrepancies of how many people really may have some true bumps in getting to that point and where they can report that. So this is a measure to actually strengthen the oversight of mental health insurance coverage in Georgia by holding insurers accountable for parity compliance, creating a formal mechanism to review and address complaints, and mandate reporting from healthcare providers. It will also enhance the public provider education on mental health parity rights and establish a state-led enforcement panel with punitive power over non-compliant insurers, not the provider of the service, but the insurer. This bill is a significant step forward, ensuring that mental health care is treated equally to physical health care with the insurance system in Georgia. So when you look at this, it expands the Behavioral Health Coordinating Council. I serve on the Behavioral Health Coordinating Council. I've been on it for several years. My appointment is through the Speaker's office. There are different appointment avenues to that council. It is out of the Department of Behavioral Health, and it pulls together a group of many of our agency heads who meet regularly. There are also side meetings, but it is to try to make sure that everyone is talking and working together. So this will create the creation of an additional appointment member, because this is all in statute, and that would be the Commissioner of Insurance. He is not currently on it, and we feel that bringing him to that table would help in the participation to continue to work toward the challenges of health and mental health parity. The council has representatives, like I said, from state agencies, behavioral health, juvenile justice, and corrections particularly. Those commissioners can send delegates to be at the meeting if they cannot be there. Scheduling is hard, and I know in Georgia we have continued to make many and more committees and commissions for all of them to come together for very certain reasons. So it will also establish a parity compliance review board panel is what it's called in here. So that will be created within the Behavioral Health Coordinating Council to ensure that insurers comply with mental health parity laws. The panel will review cases where insurers may be violating parity laws, require equal coverage for mental health and physical health conditions. The composition is laid out in your bill and includes the Commissioner of Community Health or his designee, Commissioner of Behavioral Health and Developmental Disabilities or designee, Commissioner of Human Services or designee, Insurance Commissioner or designee. Then there will be appointed members added to this group. 2 mental health clinicians appointed by the governor. 2 senior executives from mental health facilities or systems also appointed by the governor. Then 1 advocate, mental health advocate, appointed by the President of the Senate, which is the Lieutenant Governor, and 1 mental health advocate appointed by the Speaker of the House. This mandatory reporting of mental health parity violations is so very important for us to get the data that we need to understand what we are meeting, how close we are to that threshold, and then how to get there as well. If violations are found, the panel will recommend punitive actions to the Commissioner of Insurance, the Commissioner of Community Health, and those are for violations. The community health will be for the violations of Medicaid or state-regulated insurance plans. The insurance would be for all other insurance violations. There are also additional powers in this bill for the panel to analyze reports from the insurance companies and healthcare providers, to request additional information, to develop educational materials. And this is really important, not only that everyone knows that the consumer and provider understand the parity laws and what their rights are, but also the concept of mental health parity, individuals' rights, the complaint and enforcement process, and then those materials will be culturally and linguistically appropriate, multiple languages, distributed widely. This will coordinate with the Governor's Office, the Department of Community Health, and the Office of the Commissioner of Insurance to develop a guideline for enforcing that punitive action for non-compliant insurers. We're also going to establish with this legislation a support team subject to funding. If the funding is there, their responsibility will be to support the panel with research and analysis, report preparation, and educational material creation. Hopefully, right now, there is a portal that you can go to on the Insurance Commissioner's site. I believe there's one on Community Health, too, that you can report a violation. But it's a little complicated. First of all, you have to know about it. So that education process will be important. I think also there are steps to get into it, to access, to input your information. Someone going often through a crisis, that is not an easy thing to do. So we're going to challenge them with trying to find a better way to find out real-time information, collect that data, and help us work more and more toward mental health parity.
Oh, thank you. You do have a question? Representative Davis?
Chairman, my question did involve funding sources. What funding source is available to support the panel's investigative team? Have we even asked for extra funding?
It has not been asked for yet, but it's kind of that chicken and egg solution. We have to have it there to be able to ask for it. So we're in that space right now. Depending on, it's going to take a little bit of time for them to get up to speed. So I think this could well be an effort that we're looking at in an amended budget next year to see if they have come together and found their path, I would say, to do it. The coordinating council meets at least quarterly, sometimes more. And, I think this will give them time. The commissioner needs to get adjusted to it and active in it, and everyone figure out their roles and get to work.
Thank you.
Any further questions? Representative Mathiak.
Thank you, Mr. Chair. I just have a little question. I don't see dates in here, Chair Lady. Do we have an approximate for the committee?
Usually when there are not dates, that means it is upon signature. So that would mean that coordinating council will get to work. The commissioner would be engaged with them. They already exist, so we're just adding that one person to it.
Gotcha. Okay. Thank you.
Okay. All right. I see no other questions. We do have a few folks signed up to speak to the bill. Let's see. Catherine Ward.
Good afternoon, Mr. Chairman and committee members. My name is Caitlin Ward, and I represent the Carter Center's mental health programs. Today, I would like to speak in support of HB 612. The Carter Center has been a leader in mental health advocacy for decades, championing policies that increase access to care, reduce stigma, and promote preventative measures. We currently lead the Georgia Parity Collaborative in collaboration with Georgians for a Healthy Future, consisting of over 75 statewide and national organizations. Our next meeting being April 17th, and it is open to the public. Oh, sorry about that. In conjunction with the collaborative, we have continued to monitor the implementation of the parity provisions in the Act by state agencies and evaluate the public's awareness of the Act and its impact. On lines 88 through 95, the bill directs the panel to create and review educational materials. This is something that we fully support, as we have just scratched the surface in doing just this at the Carter Center. We currently conduct awareness campaigns through private donors in both Albany and Savannah, Georgia, and have started working on our newest awareness campaign in Metro Atlanta. We believe that by having the state take ownership of this type of education, there will be better communication with the public on their rights. Yet we still seen a gap in enforcement of the law, as the healthcare complaint portal on the Department of Insurance's website does not include any information regarding mental health and parity, and it is very difficult to navigate. Furthermore, DOI is required to collect and post comparative analysis reports from insurers as required by HB 1013. However, they currently do not use a standard reporting template or summary sheet, making it difficult for stakeholders to know which insurers are providing insufficient evidence. DOI also has the ability to enforce penalties to deter violations and hold insurers accountable. However, no such fines have been levied to our knowledge. In regards to the Department of Community Health, they are also required to collect and post comparative analysis reports from CMOs and create a summary based on DCH's review and analysis. While the reports are standardized between the CMOs and eligibility groups, the reports are insufficient for demonstrating what insurers are complying with parity requirements, specifically with respect to NQTLs. We believe that by creating the parity review panel, there will be more accountability by the insurance companies and better communication between departments, providers, and advocates, which will help to diminish the issues I just stated above. Thank you so much.
Thank you. Any questions? I see no questions. Representative Oliver, wouldn't you like to speak to this? I know that you're on this bill.
Thank you, Mr. Chairman, and thank you, Chairman Dempsey, for the opportunity to work on these continuing issues of parity. Many of you were here in the spring of 2022 when David Ralston led a mental health reform effort in a bill, House Bill 1013, that was called the Georgia Parity Act. The last hours of negotiation on that significant 85-page bill related to specific enforcement mechanisms for parity. Since 2022, the sponsor on behalf of Speaker Ralston, Todd Jones and I have met with the insurance commissioner, who is the individual named in 1013, modeled off the federal statute passed in 2020. Frequently, we have gathered in the Speaker's office multiple times with Speaker Ralston and Speaker Burns, and we are struggling, as the nation is struggling, with this issue. You may be aware that parity legislation federally initially was passed in the Republican administration in 2008, then 2010, 2016, and then the last action under the last part of the Trump administration in 2020, the first Trump administration, all of which have set forth a mechanism nationally for the states, now under the insurance commissioner's leadership, to effectuate and implement true parity. Other states are struggling in some of the ways that we are struggling in Georgia, and this recommendation of increased enforcement powers has come through the Commission on Behavioral Health, chaired by Kevin Tanner, and Commissioner Tanner has been working on this specific legislation extensively. I'm on the commission, and the parity challenge is not unique to Georgia, but is something that Georgia is leading based on the enactment of 1013, and I think this bill really helps our enforcement and our leadership opportunities for the nation. Thank you for allowing me briefly just to speak on this little bit of history and the importance of this bill, and thank you, Chairman Dempsey, for my opportunity today also.
All right. And thank you for all your work over the years on the parity issue. Any questions? Okay, someone else would like to speak? Jeff Breedlove.
Thank you, Mr. Chairman. If it pleases the committee, I'm Jeff Breedlove. I'm a person in long-term recovery from addiction, and it was a great privilege to be involved in House Bill 1013, and want to thank Chairman Dempsey for bringing this legislation forward, and for Representative Oliver and Jones for their leadership, and of course Speaker Ralston laying the foundation. I'm here for the Georgia Council for Recovery, the mental health policy partnership representing over 40 organizations, and the American Addiction Recovery Association representing families and survivors across Georgia. We support this bill very much, but we should not have to be here for this bill. But I want to commend the Behavioral Health Reform Innovation Commission for their leadership and transparency. Struggle is a polite word. I don't want to take too much time. I just want to say this. Families across Georgia, working class families who do not have the time or the money, are encountering roadblock after roadblock, hurdle after hurdle to save a life. And the number one cause of death in Georgia right now for Georgians 18 to 45 is overdose and fentanyl poisoning. So every day we delay, every other meeting we have to go to, in the world we understand, we get it. But for working class families, it's Russian roulette with the life of their loved one. So we commend the commission for their work. We commend the chairman for bringing this legislation, and we would ask for a unanimous vote of support. Thank you, Mr. Chairman.
There is a question. Representative Douglas.
Yes, at the appropriate time.
Now's appropriate time.
I make a motion to pass.
Is there a second? All those in favor say aye. Aye. All those opposed? The ayes have it. So LC 339795, House Bill 612, is a due pass. Congratulations.
Thank you.
All right, Mr. Chairman, we will get started with your House Bill 571, LC 461142. Chairman Hawkins to present.
Thank you, sir. This is a bill that we heard last year on radiology assistance. This is a bill that allows the assistants to achieve a higher level of technique, injections, and so forth to help a radiologist see more patients and actually gives them time to read. This is not diagnostic on the assistant's part, but this is more of a technique thing. This was brought to me by the radiologist of Georgia last year. It went all the way through, laid on the table in the Senate, just didn't get picked up. We did meet with the board in December. They did suggest a few words that you will find in the bill that's added to the bill. And I'm going to let Becky Riles speak to this, if that's fine with y'all. We do have an amendment, I think, that y'all all have in there too. But Becky, if you'd like to come up.
Yeah, I'll be right back. All right, Becky, thank you for being with us today.
Thank you, Mr. Chairman, members of the committee. I'm Becky Riles, representing the Georgia Radiological Society and also the American Registry of Radiologic Technologists. This bill starts first with your rad techs helping patients in your district. So currently, when someone goes to school to become certified as a rad tech, that is really the extent of their career path. And so what this bill contemplates is enabling an RT to go back to school for an additional 2 years to become a radiologist assistant. So essentially their role is to be a radiology extender. So the radiology assistant can meet with the patient, can measure organs that may be about to be biopsied, make sure the patient has been compliant with whatever protocols are necessary for the procedure, and then the radiologist can come in the room and do the procedure, right? So to Chairman Hawkins' point, it allows the radiologist to stay in the reading room longer so that they can then get the results of diagnostic studies back to other providers, back to ER physicians, for example. Someone who comes into the ER is really just, a stat needing that imaging as well as the interpretation. So it really increases the efficiency of imaging studies for patients. It also increases access because it can reduce the backlog in some areas of our state where there may be a wait time before you can get a diagnostic study done. So that is, in essence, the purpose of this bill. It would authorize the Composite Medical Board to license radiology assistants in Georgia, and the board would then promulgate rules and regs about the protocol agreements that would be in place between the radiologist and the radiology assistant, as well as the number of radiology assistants that could be supervised at one time. So while they are a mid-level provider, radiology assistant, the radiologist would not supervise as many RAs as, say, other physicians supervising other mid-level providers, if that makes sense. So at this point, it would be around the number 3 to 4 that a radiologist would be able to supervise at one time. So these individuals would work in the hospital setting, they would work in imaging centers, and in essence, it would increase the access to care and the quality of care for patients to get the imaging studies done sooner, and more importantly, get the results back to the patients in a more timely fashion. We appreciate Chairman Hawkins bringing this measure, working with us to craft the language that you see before you. He mentioned that the Composite Medical Board had some changes that we've incorporated into this new version, HP 571. We've also incorporated some language in feedback that we've gotten from radiologists around the state. For example, on line 101, and you'll see it in other portions of the bill, according to levels of supervision as defined by the Centers for Medicare and Medicaid, this just brings consistency in how these mid-level providers are supervised across our state. So with that, I will pause and see if there are any questions. Would you like for me to speak to the amendment, Mr. Chairman?
Yeah, why don't you go and speak to the amendment?
So in your folder, it's just this piece of paper here on line 133, and this comes to us again from feedback that we are receiving from around the state from radiologists who are in the practice every day, and so we're trying to perfect this as much as possible as it moves through the process, as well as it matching the reality of what radiologists are facing in their work every day. So line 133, strike the period and add the following. And you can see the language there. This relates to radiology practitioner assistants who are PAs who go back to become a radiology practitioner assistant or an RPA. And so this language just really establishes consistency in their maintaining their certification and registration the same as the radiology assistants would.
All right, thank you for that, Ms. Riles. Any questions for either Chairman Hawkins or Ms. Riles about the underlying bill or the amendment?
On the amendment, just the wording. So you would finish that sentence that's there, or how would that be added?
So that would be incorporated to 133. And then,
Between the period, you remove the period on 133, then below that you do parentheses 3, and that wording is added.
And maintain, okay.
yep,
And the only add I'll have to that amendment that's in front of you is on line 31, excuse me, line 131. We need to strike the "and" there as well.
thank
All
you.
right. No questions from either of you. Don't have anyone signed up to speak. What's the pleasure of the committee? All right. We have a motion. We have a second. Any discussion? No discussion. All right. Now's the time to consider an amendment.
Make a motion to add the amendment, which would consist of striking words "and" on line 131, then striking the period on line 133, and adding 3, maintain the rest of the language.
Thank you so much. Thank you so much for that, Chair Lady Silcox. I'll take that amendment as a motion. Do we have a second? Do we have any objection? All right, the amendment is added. All right, now we have the underlying bill before us. LC 461142, House Bill 571 as amended. All those in favor make it be known by saying aye. Aye. All opposed, like sign. All right, Mr. Chairman, one of two. You ready for the second one?
Yes, sir.
All right. Now we'll consider House Resolution 72, working off of LC 460967. Chairman Hawkins.
Thank you. This was brought to me by the Cancer Coalition and groups. I think we've all been touched by cancer, and it's still a very elusive health issue for all Georgians. Rural, metro, it knows no age and no limits. So you have before you a resolution that's calling for a study committee. And on page 2, you'll notice that there's 5 members that will be appointed by the Speaker of the House, and on. It describes powers and duties, meetings, allowances, as usual, and of course a report at the end of this study committee. I think that's self-explanatory, and due to the time of day, I think we do have a couple people who want to speak to it. Mr. Chairman?
Thank you so much. Before we bring any witnesses up, do we have any questions for Chairman Hawkins? I'll just say thank you for this work. Certainly I've experienced this with my family. I appreciate you doing this. Let's move on to our witnesses. Ray Williams with the City of Hope. If you just want to come to the mic over there.
Thank you, Mr. Chairman. I'm Ray Williams with City of Hope. You may know that formerly as Cancer Treatment Centers of America. City of Hope acquired CTCA in 22, and we are now a nonprofit organization. And believe it or not, we're actually members of GHA, the Alliance of Community Hospitals in Hometown Health. We have. So it's nice to be here in a role to say we support this resolution. We want to offer our services and our resources to the study committee as we can. We are doing outreach all over the state to help folks with rural hospitals, with physicians to better understand how cancer care can be delivered. But we just want to be a resource and offer our help on behalf of the study committee.
Thank you, Ray. Any questions for Mr. Williams? Don't see any. Thank you. All right. We also have Lynn Durham signed up to speak.
Thank you, Mr. Chairman. I'll be very brief, and thank you, Chairman Hawkins, for taking this up. So I'm with Georgia Core, the Georgia Center for Oncology Research and Education, and we have worked for over 20 years to improve cancer care throughout Georgia. I'm also here to represent the Georgia Cancer Control Consortium, and those are volunteers around the state who also work with the regional cancer coalitions and others to improve cancer throughout Georgia. So 25 years ago, the state started receiving tobacco settlement funds, and of course that was to ameliorate the effects of smoking and tobacco on Georgians' health. And so in that time, you and the governor have done wonderful things for cancer care, but we haven't really taken a look in quite a long time and what we're doing to serve the entire state. Georgia Corps works a lot with our rural areas to try to provide access to quality cancer care for rural areas. So we believe this study committee will take a look at workforce, look at the oncology workforce throughout our rural areas and other small cities, and really just take a very wide-ranging look at screening, prevention, and other areas for cancer. And so we'd be very appreciative if you would approve this resolution. Thank you.
Important work. Any questions for Mr. Durham? Don't see any. Chairman Hawkins, you want to have a last word? Or?
I appreciate Lynn very much. She brought this resolution to me. I can tell you, as my wife has had breast cancer, and I've had people in my family die of breast cancer. It's always a challenge. We have a number of groups out there that raise funds, and my wife and I were part of one. It's just a short story about my cousin who had breast cancer the second time recurrent, and at that time the insurance companies would not pay for the wig because they said it was not caused by the disease, it was caused by the treatment. So we started raising funds to buy wigs for women. So this is something that's dear to my heart, and I think we probably all have been touched in some way by cancer. So I look forward to the possibility of this study committee being formed this year and doing some more work on this. Thank you.
Thank you, Mr. Chairman. All right. What's the pleasure of the committee? All right, we have a motion. We have a second. Any discussion? All right, now we have before us House Resolution 72 LC 460967. All those in favor make it be known by saying aye. Aye. All those opposed, like sign. All right, the resolution moves on unanimously. Don't see other business coming before the committee. We can stand adjourned.